Every weekend, bars or restaurants are filled with fans. Grills are lit in backyards, and the sounds of cheers come from the stadium. Everyone enjoys a good game of football, whether it is high school or professional, from the postseason to the Super Bowl. But is the sport we love becoming too dangerous? The first question that I ask myself is when it comes to the Time magazine article, The Problem with Football, How to Make It Safer, is to define safe. With the rise of concussion awareness comes more rules and penalties for helmet-to-helmet contact. I agree that intentional contact such as targeting should be a penalty. However, when it comes to the clean shoulder contact, it is a clean hit. With the introduction of the new NFL rules, players are avoiding the head when making tackles, but they are intentionally making legal hits below the waist, which has actually increased the amount of lower body injuries this season. So in that aspect, does it make it safer? Compared to the previous 7 seasons in the NFL, catastrophic injuries, which include neck fractures, severe traumatic brain injuries, and mild traumatic brain injuries or concussions, have been on the decline. With the implementation of observer athletic trainers, as well as independent neurologists evaluating concussions in the NFL, it is a step in the right direction to a safer sport. There are still some ways to make it safer, and most of the time, it is as little as teaching the proper technique. A question that comes to mind when thinking of football safety is how young is too young to play football. In my personal opinion, a safe age to start football is between the ages of 10 and 13. When I ask some professionals who are involved in athletics, which include an orthopedic surgeon, an athletic trainer, and an athletic director, they all agree with that age gap, maybe even older. The reason behind it? Brain and body development. With starting at an older age, the child will have a better neurological and better physical baseline to work off of so that the risk of injury will be at a lower level and they can better understand what had happened to the body if something was to occur. If you want to increase safety overall, you must start at the lower levels. Proper techniques, such as hitting with your head up and hitting with your shoulder instead of the crown of your helmet, must be taught from the beginning. With proper technique comes safer play and smarter play. Another step that I am a huge advocate for is the presence of certified athletic trainers at all practices and all games in every sport. A certified athletic trainer is defined as a healthcare provider who is specially trained in the recognition of sports-related injuries, including concussions. All professional, semi-professional, and universities are required to have them included in their sports medicine staff by law. However, according to the governing body of certified athletic trainers, the NATA, or National Athletic Training Association, only 42% of high schools and middle schools in the United States have access to athletic trainers. The major reason behind this is funding, but to sum up what Dr. Kevin Guskiewicz says, if you cannot afford an athletic trainer and the proper equipment to keep your athletes safe, you may want to rethink having a sports program. With the evolution of technology will come more and more advanced ways to increase safety in all levels of athletic participation, not just in football. Football is on the right path to becoming a safer sport, but with every new advancement comes trial and error to get it right in the middle, to make it a fun sport to watch and play, but not a game of adult males getting paid millions of dollars to play flag football.